Director of the Office of Management and Budget, Mick Mulvaney. Director Mulvaney, thank you for joining us this morning. So I wanted to get a sense of how the president is going to deal with these competing promises. He's promised to repeal and replace Obamacare. He also said he wants a plan that provides insurance coverage to everyone. That's in the Washington Post on January 15th. We're showing it right there. We're going to have insurance for everybody, much less expensive and much better. And during the campaign, he promised no cuts in Medicaid. Tweet from May 7th, 2015. I was the first and only potential GOP candidate to state there will be no cuts in Social Security, Medicare, and Medicaid. But as you know, so far, the independent analyses of your bill show that 6 to 15 million Americans are going to lose their coverage they now have under Obamacare. And there will be about $370 billion less in federal funding for Medicaid over the next 10 years. So how do you square that impact with the president's promises?
George, there's a lot of moving pieces at one time. Let me see if I can break it down into smaller pieces and parts, and we can talk about a bunch of different ones. Talk about the coverage levels, the number of people covered. We continue to think, and have for a long time, that the CBO is scoring the wrong thing. They're scoring Obamacare as it exists today, not tomorrow. Obamacare is this close from completely collapsing. For example, I live in South Carolina. We are down to one provider in that state. There's 4 or 5 states that I think are down to one provider, and the CBO is failing to take into consideration what happens to folks in South Carolina when there are no providers, which there may be as soon as next year. So we don't think the CBO is counting correctly that way. But at the same time, we also think they're not counting the right thing. Go back to the original idea of Obamacare was supposed to be that people could afford to go to the doctor. They can't. They can afford to have coverage. They can afford to have a little plastic piece of paper that says they have an insurance policy, but they can't afford to go to the doctor.
But the president said insurance for everybody.
I was on Obamacare when I was in the House. My family's deductibles were over $15,000 a year. Other folks who don't make as much money as I did were on the exact same plan. Do you think they could afford to go to the doctor? That's what we're trying to fix. Not coverage for people, not coverage they can afford, but care they can afford. When they get sick, they can go to the doctor. That's what the Donald Trump plan is working on, and that's where we think it's going to be wildly successful.
Well, but they will have less money to pay for that coverage right now, less money to pay for that care. But also on the point of Medicaid, the president said during the campaign he would not cut Medicaid. This bill is going to reduce federal Medicaid funding by about $370 billion over 10 years.
And still give better care, because we're actually giving the governors what they want. I was here with dinner with, I think, 46 of the state governors about 2 weeks ago, and one of the things they kept asking for was more control over their own Medicaid. Again, I was in the state legislature. We would have begged for more control over how our Medicaid dollars got spent, because it's essentially a one-size-fits-all.
They're not begging for fewer dollars, Mr. Director.
They're begging for better control so they get more efficiency and more ability to serve their people. The Medicaid system as it exists today is a one-size-fits-all system. We fix that. You can provide better services for less if you get the federal government out of the way. That's another thing this bill does.
So are you simply saying that if the Congressional Budget Office comes out tomorrow or the day after and says fewer people will be covered, many millions fewer people will be covered, the cost will be going up, that you're simply rejecting that analysis?
Actually, I don't think the cost will go up at all. In order for this bill to be reconcilable in the House, as you know, and we're getting deep down into the rules of the Senate now, I apologize for doing that, but in order for this bill to pass on budget reconciliation, it has to reduce the debt and thus save money.
But how about on the coverage, though? If it says that fewer people are going to be covered, you simply reject that?
If the CBO was right about Obamacare to begin with, there'd be 8 million more people on Obamacare today than there actually are. So I love the folks at the CBO. They work really hard. They do, but sometimes we ask them to do stuff they're not capable of doing. And estimating the impact of a bill of this size probably isn't the best use of their time.
So it sounds like you're going to reject. Let's move on now. Senator Tom Cotton coming up on the program next. And he said it's time to slow this down and start over. He told our John Carl that your bill is going to make the system worse than it is now. Let's listen.
I'm afraid that it could make it worse in some ways, that insurance rates would continue to go up, and that Americans would have even less control and less choice over their health care systems. That's why I say that it's time to take a pause, take stock of how we got to where we are.
What do you say to Senator Cotton?
Tom's a good friend. Senator Cotton's a good friend, and here's what I tell him. He knows how the House and the Senate work. Things move through the House relatively quickly. This is still going, by the way, much slower through the House than Obamacare did. We already had 2 committee hearings, which I believe is 2 more than Obamacare had in the House. We'll have another committee hearing this week, and then another committee hearing next week before the vote goes to a vote. The bill goes to a vote on the floor. Then things will, as they always will, and as the founding fathers intended them to, slow down in the Senate. And I'm sure Tom will get, Senator Cotton will have a chance to review the bill, to amend the bill. Let's not get lost on that, George. This is the framework. This is the bill the president has looked at and said, yes, this is what will work. If the House thinks they can make it a little better, if the Senate thinks they can make it a little better, we are open to talking about those types of things. There's no reason to rush it, but it's not being rushed as things stand now.
He says this is going to increase premiums.
I happen to disagree with Senator Cotton. One of the things, many of my friends on the right, I used to be a member of the right-wing caucus in the House, they make the same complaints, and my point to them is I think they're discounting the value of competition. Again, go back to the example where I live in South Carolina, one provider. Under the plan that we're talking about now, we already know that more providers will come into South Carolina, and that competition, the competition that Republicans so often want in so many parts of our economy, that competition will tend to drive down premiums.
Your former colleagues in the House, conservatives in the House, have met with President Trump, and they say he's open to moving up the date where you phase out the Medicaid expansion, perhaps as early as 2018. You're willing to negotiate that in the House?
I was in those meetings, and we had some great discussions, and I'll tell you what we told them in the meetings. The bill here is the framework. It's a really nice framework. We like it. It's a good repeal and replacement bill. If there are ideas in the House, I think Congressman Barton from Texas had some ideas. I think Congressman Morgan Griffith from Virginia had some really good ideas regarding things like changing the expansion date or perhaps putting work requirements in on Medicaid. Those are great ideas that would improve the bill. If the House sees fit to make the bill better, they'd certainly have the support of the White House.
So you're behind that right now. How about the opposition of the AARP? They've put out an ad where they're saying this bill is going to be an age tax on middle-income Americans. Let's listen.
It allows insurance companies to charge an age tax on older Americans. Combined with fewer tax credits, this could mean an $8,000 a year premium hike on those who can least afford it. Unacceptable. Second, the bill gives big drug companies a sweetheart tax break while doing nothing to help lower drug costs for everyday Americans.
In the meantime, the New York Times is reporting that the Joint Tax Committee concludes that your bill will provide about $157 billion in tax cuts to people with incomes over $1 million in the next 10 years. Yet, older Americans, middle-income Americans, are going to be paying more for their insurance. How is that fair?
Yeah, I think that's the same group, the AARP, that did the television ads of a guy that looks a lot like Paul Ryan pushing Granny off the edge of a cliff back when we first started talking about budgetary reforms back in 2010. And my guess is that the millions of emails that that group and other groups are sending out today have a little click here to donate button at the bottom. They're not in the news business. They're not in the business of fixing things. They're in the business of trying to protect their own self-interests and to raise money. And that's unfortunate that that's where a lot of folks will get their information. Look, we promised to repeal the taxes for Obamacare. That's what the bill does. I think we should focus more on the benefits that folks are going to get from the improved health care, the affordable health care, not just affordable health coverage, that this new level of protection, this new bill would provide.
But they're pointing out that older Americans, especially those from the ages of 55 to 64, are going to be paying more because insurance companies will be able to charge them more.
And I seriously doubt that any of those analyses take into consideration the fact the use of HSAs, health savings accounts, the lower premiums that come from competition. These are a group of listen, everybody's got skin in this game, right? Everybody has an interested party, and they're trying to protect their own. What we're trying to do is make things better for as many people as we possibly can, and right now the bill's doing exactly that.
But the burden may be falling hardest on older middle-income Americans, and your critics are saying this is a massive transfer of wealth from lower-income Americans to upper-income Americans when you combine the tax cuts with the loss in subsidies for middle-income Americans.
Well, I'm not sure where they're getting that. A massive transfer of wealth. George, what we're doing is making sure that the truly indigent still have care. Medicaid is still there. In fact, we think it's going to be even better. The people who are just above Medicaid but still have difficulty buying their own premiums will not only have the refundable tax credit, but they'll have the ability to use HSAs to pay for their health care on a tax-advantaged basis, just like you and I get. So I don't understand the criticisms lobbed in that fashion. The bill actually helps a great many people and helps them get something they need, which is health care, not health coverage. Millions
are going to be paying more, and the wealthy are going to be getting a tax. But let me move on now to the State of the Union. And the President...
George, I'm sorry. I won't let you move on from that. I mean, you're taking that as if it's gospel truth. That's the argument of a group of people who don't like the bill. So we repeal the taxes in Obamacare. It's what the Republicans have done from the very beginning. The fact that certain groups will pay less tax is not central to the issue. We've done this in a fashion that allows the people who cannot afford health care now to get it. I don't know why some people are so dead set against other people benefiting at the same time.
But those who are getting, those who are getting subsidies right now, they're going to be getting fewer. The tax credit is going to be worth less than the subsidies, and insurance companies are going to be free under your bill to charge older Americans more.
And you're falling into the exact same trap I talked about at the opening of this segment. You're worried about giving people coverage, and it's almost as if
the president said he wanted everyone covered, sir. The president said that.
He wants everybody to get care.
That's not what he said. The president said he wants everyone covered.
What people want is to get care. People want, when they get sick, they want to be able to afford to go to the doctor. And that's where Obamacare has failed them several times over. That is the problem that we are fixing, so that when you're watching this program, when you get sick, you can afford to go to the doctor. Because right now in Obamacare, you can't. I had it, George. I know. I've lived through this firsthand. You didn't have Obamacare. I did. $12,000, $15,000 of deductible for my family. Luckily, we could afford it. But people making much less than I did had that exact same plan. Yes, they got a subsidy in order to buy that plan, but they didn't get a subsidy on their deductible. They could not afford to go to the doctor. That was a broken system. That was one of the many, many reasons that Obamacare was failing, and people are begging us to replace it, and that's exactly what we're going to do.
Finally, Congressman Cummings is also coming up on the program. He met with the president this week about giving Medicare the ability to negotiate drug prices. Here's what he said after the meeting.
He was enthusiastic, and he was clearly aware of the problem, and clearly he made it clear to us that he wanted to do something about it.
So is the administration going to get fully behind this idea to have Medicare negotiate drug prices directly?
The one I'm more familiar with, George, is how we're looking at trying to figure out a way to drive down drug prices through changing the regulatory requirement. Mr. Cummings, Congressman Cummings, and I used to serve on the Oversight and Government Reform Committee together. We participated together in a hearing on the high price of the EpiPen. I think the one that cost $600 for two here and a couple dollars each in Europe. And one of the things that he and I both learned together was that it's government regulation, the inability for drug companies and medical device manufacturers to get things approved, government intervention that is driving up the cost. And I do know for a fact the administration is going to be looking directly at trying to figure out a way to fix that. And I know and hope that we can count on Congressman Cummings' assistance in doing that.
So he was wrong. The president is not committed to giving Medicare that power to negotiate drug prices?
I wasn't in that meeting. I'm telling you, it's consistent with what the president is doing, which, again, back to the discussion about the new health care plan, trying to drive down the cost of actual health care that men and women in this family have to pay.